Hello, hi, and welcome to another episode of Wellness in the Workplace. My name is Mbali Mzinyane, and I am your host. Wellness in the Workplace is a podcast that aims to equip new and experienced professionals with tools to navigate workplace dynamics. So the World Health Organization estimated that in a company of about 1,000 employees, 200 to 300 workers will suffer from a serious mental health problem in any given year. One worker will die by suicide every 10 years, and for every employee who dies by suicide, another 10 to 20 will make a suicide attempt. Those stats are actually quite chilling. Today's episode, we are talking about suicide awareness and prevention, specifically within the workplace. I'm in conversation with a specialist psychiatrist and the founder and host of a platform called Mind Vault, which is a platform that's dedicated to raising awareness around mental health related issues, as well as destigmatizing mental health within the workplace, in our communities and beyond. Welcome to the podcast.
Thank you, Bailey. Thank you so much for having me. I'm so excited.
Sure, I'm excited about our conversation, but also it's quite a heavy one to talk about, right?
It is a heavy one. When I got the brief, I was like, all right.
Yes. And I think it does need a lot more attention because, over the years, we have been seeing news events of, mental health related issues rising within the workplace. Attempted suicides, which may have gone reported, some unreported, and actually suicides that did occur, and people unfortunately lost their lives as a result of challenges that they may have had in the workplace. So I think it's a timely conversation. I think it's an important conversation, an uncomfortable one, but very, very necessary. But before we go into just our discussion, I'd like to get a bit of context on my guest so that people who may know you, some who may not know you, can also just know exactly what work you do and how it is that you specialize in a topic such as this.
All right, so I'm Clementine Chawane, and I always say Clementine, not Dr. Clementine. It's something that I'm still having to learn to do. So I'm a psychiatrist, meaning that I'm a medical doctor who is specialized in mental health and mental disorders. And so we look into how the brain, which controls our emotions, our thoughts, and our behavior, gets compromised, and how that physically manifest, whether as depression, as burnout, as anxiety, as schizophrenia, as post-traumatic stress disorder, and all the other 157 illnesses that are recorded. And actually the number is just going up with each and every edition, because we use this Bible of psychiatry called DSM, and now we are on DSM-5, but it started at DSM-1, and sometimes it's DSM-1A and B. So over the years, the number of illnesses have actually increased. And, the argument is that, are we becoming more vulnerable? But for most scientists, is that we are becoming more aware, and we are starting to put words into how people are really feeling, because people have been feeling like that for a long time, but because there was no criteria to diagnose, and then it was dismissed, no, you will be okay. So I don't think we are becoming more vulnerable more than we are becoming aware. So that's basically what we try and do. And the aim is not to diagnose people so that they have a label and they feel like, okay, my life is over. It's more to have a diagnosis so that we can see how best we can help you deal with the illness that you have. Like if you had diabetes, how do we help you control your sugar? What are the things you need to do, and what are the things you should avoid so that you can be healthy even though you have this illness? Because it's not the end of your life just because you have a diagnosis, whether it's physical or mental health related.
100%. I think then in the context of mental health awareness within the workplace, I think we saw a rise of that post-COVID, right? What that period really did is that it made people stop and to just reflect on maybe how they've been conducting themselves within the workplace, how they may have neglected their mental health, and now from that time, we have seen a rise of people speaking more openly about some challenges that they may have within the workplace, specifically related to mental health issues. And, you know, podcasts like Wellness in the Workplace was established post-COVID, right? As a result of just raising awareness around wellness-centered cultures that need to now be within the workplace so that employees are more empowered and they are more present, and also just have those tools to be able to take care of themselves. So why do you think then a topic like suicide awareness and suicide prevention is important, specifically at work? What have you noticed in your practice over the years that has made such a topic like this relevant?
Okay. So look, you know what? So suicide on its own is a very complex thing to understand. It can be part of a more complex issue that is happening. You know, it's not always related to mental illnesses. It's not that only people who have depression and anxiety can commit suicide or feel suicidal most times. I think it's something that most people experience, actually, whether it's what we call passive suicide or active suicide. The passive suicide is, I wouldn't mind if something happened to me. I don't want to kill myself, but if I got hit by a car and I died, I wouldn't mind, because I'm feeling overwhelmed, whether it's because I'm in debt or my relationship is not working out, or I'm just made to feel inadequate at work, no matter how hard I work, you know. And then the active suicide, it's when somebody actively does something. But it starts most of the time as a passive suicide thing, and then it gets to an active suicidal mode. So in clinical practice, which is not necessarily stats that you will find on an article, but like you're saying, since COVID, there has been a lot of patients who are admitted, meaning that they're having a severe side of things requiring admission, and most of them are complaining about work-related stress, right? So, you know, before COVID, one of the things that would make people come into the hospital was relationship difficulties.
Related, interesting.
You know? But now it's work. Everyone is work. I have learned about managers. I have learned about toxic work environment and all that. And so that is a very important topic for us to have. And another thing is that most people spend their time at work. I mean, I don't remember the numbers, but I mean, if we're spending how many hours a week?
40 hours a
40
week.
hours a week. It's more than the time we spend at home, because even when we're spending the time at home, we're usually sleeping because it's at night. So we're not really spending active time. So most of the people are spending a lot of time actually at work than they realize. And so it is important that we make the work environment as healthy and as pleasant as possible, because that's where most adults are spending their time. So there has been a rise, and the thing is, I feel like it's still underreported.
Sure.
All right, I think like rape in South Africa, suicide is underreported, and we see it because when I ask my patients, was this the first time? No, it wasn't the first time. The other times, what happened? No, I just slept it out, or I never told anyone. And even the few reported incidents that occurred last year, there was nothing conclusive, right? It was just like, we're gonna investigate. So there was no employer who came out and say, yes, this person was stressed out at work, and we failed to support, but we're looking into improving our mental health policy. It just brushed under the carpet, and it's ignored. You know, so it might not happen necessarily in a workplace. Like, not everybody's gonna hurt themselves at work, but they might have hurt themselves at home, but they're carrying the burden that is mostly associated with work.
Yeah.
You know, and so if I don't attempt suicide at work or during work hours, then it becomes a personal thing.
Sure.
And most of the patients won't go to their managers or their HR and said, I was admitted because I attempted suicide. I was admitted because I was depressed. And so they won't say the details.
Yeah.
And most of the time it gets dismissed. And so it must be something that is actively done in the workplace to help individuals.
Yeah. What would you say are some of the common misconceptions about mental health and suicide, specifically within the workplace? I mean, you're already touching on, potential areas of stigma that individual might fear, and in them not addressing what the issues are because of the fear of stigma, then they carry that burden home. But what are some of the other misconceptions that you think are present related to mental health and suicide awareness in the workplace?
I think most people in general, when they are feeling suicidal and hopeless, they are said they're weak. At work they might use you are incompetent. You can't manage your personal life or your work life, and I think the incompetence part, because now that you've spoken about the mind vault, there was somebody who reached out and said, I'm in a predicament, and it's not like they're suicidal, but they're having a condition that is affecting their productivity at work. And it's like, should I report to work because I'm worried it will affect my career progression? At the same time, I am struggling, and I want them to know so that they can be able to support me. And it becomes a difficult place where people sometimes refuse to get a psychiatry sick note, because they're like, no, I'd rather go to my GP to be booked off rather than have a psychiatrist book me off, because I don't want work to know that I'm seeing a psychiatrist, because then it just means there's something wrong with me, but not in the sense that, oh, you're having diabetes, what can we do to help you? It's more like, oh, you're going to be a liability, to our company. And so, there's there's an increase, or there's a better position that we want to give somebody. But I'm worried about Mbali. I don't know if she will be able to handle this, because last year she was admitted in a mental health hospital.
Sure.
So I feel like people just put a blanket on anyone who's struggling and just say you are lazy, you are incompetent, and you're a liability. And what they try to do is that they try to push people out. So they frustrate them even more and make work difficult, so that hopefully they will resign and go look for work somewhere else. So it's a big thing, but I think that is the greatest misconception, is that you're lazy and incompetent. And it has nothing to do with that. They might not be productive, but doesn't mean that they're incompetent, or they might be incompetent at the specific time, but if they can receive the help they need, they might flourish. Because why did you hire me in the first place?
Exactly.
You saw potential. All right. And I've stayed in the company for so long, and I've been doing well. And suddenly when I'm not doing well, you don't come to me and say, Bali, I know you to be competent. I know you to be friendly. I just feel like there's something that has changed about you. How can we help and support you? They actually come and threaten them. If you don't pull up your socks, we're going to let you go. And that even increases the stress and the anxiety that somebody already had, and make them even more incompetent and less productive.
Sure. That's that's actually quite frightening, because what it speaks to is a lack of education around mental health issues, right? And the understanding that if one is struggling with a mental health related issue, it's a direct reflection on their abilities and competencies, when that is not the case. And I like the point that you mentioned around if you are aware of such challenges, right, and you put treatment, or you understand that they need a level of support, then that would be the thing that pretty much helps them and allows them to be more productive and to be present. But I want to talk a bit more then about some of the other issues that then lead to increased risk of suicide, right? So we spoke about stress, potentially even burnout, the lack of recognition within the workplace, and just other areas that contribute to the suicide risk.
Yeah.
What would you say those are outside of, stress and burnout? And how can individuals then learn to manage that to prevent getting to a point of burnout, for example, or getting to a point of having heightened levels of stress where they can't manage that stress and, it spirals into something else?
Yeah, I think if I can start by explaining that there is a bi-directional relationship between mental health in a workplace and personal well-being, right?
Okay.
And so, when I start with personal well-being, part of an adult personal well-being is about productivity. All right, is about building a legacy. It's about being an active member of society, contributing to society. That is good for our mental well-being. And so, what we call the psychology of work, which have shown that people who work have more benefits than people who are not employed psychologically, whether it's self-esteem, whether it's having an opportunity to leave your home environment and go and interact with different types of people. Because when you're unemployed, you're sort of like stuck with the same types of people. And so leaving your environment, which is sometimes not pleasant, and go to a place where you can laugh and you can be distracted and you can think about something else instead of your constant problems that you face at home is good for our well-being. And so when we are as individuals mentally well, then we are able to be very productive at work. Okay. And so if I'm not well in my personal life, it might affect my work. Okay. And then the other angle is that the work-related stresses can compromise my personal well-being. So if I'm not performing, or if I am stressed out, meaning that I have more responsibilities that I had in the past, I don't knock off at 5 o'clock, my boss still calls me at 10 o'clock at night requiring something first thing in the morning, and by that suggesting that I must not sleep tonight because I have to work on this project that you're demanding that I need. And we saw that with COVID, right? Because then there was, you're working from home, I can call you anytime. And so that has resulted in people overworking and therefore having a higher risk of a burnout. So the risk for suicide or burnout or mental illness, then it becomes difficult to say, is it really work related, or is there something that is happening in my personal life that I'm not dealing with, that I now take my problems from home to a work environment and vice versa? Do I take my work-related stresses to my home? And all I do is complain about my boss, and I'm not sleeping, I'm not eating, I'm not spending time with family, which then, bring fights at home. And it just becomes a vicious cycle. And so sometimes it's difficult to know which one started, So the risk factors are difficult to say, these are the risk factors that are coming from work. But most of the time when the patients are coming to complain, they would complain about a toxic work environment. And I have learned to qualify that. I ask my patients, can you describe what a toxic work environment is? Because sometimes we can overuse this word toxic, right?
Yes.
And so, yes, people would complain that I have a toxic work environment, whether it's because I work more hours than I am contracted to work. And I feel like I can't say no because I'm afraid I will lose my job in an economy where I can't afford to lose my job. It's how I'm spoken to. All right. It's like my boss won't even greet me or anything. It's just, I need this thing done and I need it now. And so meaning that I have to put aside whatever I was meant to do to attend to this, which compromises my work, and I'm going to be criticized for not doing my work.
Sure.
So things like that are part of the reason why people just feel anxious when the sun rises. You know, people will tell you that on a Friday, my heart rate goes down, I'm more relaxed, I sleep better. And then suddenly on a Sunday afternoon, I can feel the tension. And sometimes they're not even able to associate the two. That on Fridays, because I don't have to wake up for work on Saturday, and on a Sunday, your body now is like, oof, we're going to this place, you know. And so if I wake up and I'm going to a place and I'm anxious, if you think about it in a sense of a temperature, I always say to my patients, if you go to a place and your temperature is already 40 degrees, and let's say for argument's sake 60 degrees is a point of an explosion, you know, just when you wake up and you go to work and you're at 40%, what are the chances that you might not reach 60? And sometimes you might not reach 60, but you are like 55.
You'll come close. You'll come really close.
And so it's like a volcano that is just brooding. And then eventually it erupts. And most of the time it erupts over a relatively smaller thing. You know, so you will break a glass and then suddenly you have a nervous breakdown, meaning that you cry uncontrollably or you have a panic attack, and then everybody's like, you just broke a glass. No, it has been a build-up that people are just ignoring and say, no, it's fine, I have to do this, and then you have someone who can see that Mbali is not well, whether she's irritable, you know, whether she's just slow, she's making a lot of mistakes, she's anxious, she's panicky. And instead of coming and, hey, let's have a meeting, I'm concerned about you, is there anything I can help? They just say, you don't look great, you must sort yourself out. Oof. All right? And that just invalidate people. And they don't know where is a safe place for them to go and seek help. And when they come to us and I'm like, you're not okay, you know, you're bent out, your tires, you're just, you know, you're driving on the steel, you know, your tire fiber is gone.
Yes.
And so there's no way you can drive. You're going to make a huge accident. I need to book you off, you know, just for you to recuperate a bit. Let's re-strategize. Let's get you to sleep without having to worry about waking up tomorrow and go to work. And they say, I can't. I can't, Dr. Chawane, work will not understand. You know, so it's just a lot of things, but most of the time it's a vicious cycle.
Yeah.
Right? It's not like a list that if we tick, you know, and then things will be sorted. It's just a vicious cycle because it's a continuation. It's not that I leave my sanity at home when I go to work, or I leave my sanity at work when I go home. I go with the same stress. I go with the same insecurity. I go with the same pressures to all my environment. And so it's just a buildup of stuff.
Sure. I mean, you spoke about then potential areas of intervention.
Yeah.
So when a patient comes to you and they are at that state, right? They are running on reserve, or they are running on the steel, and the tire has worn out. What are the first lines of intervention that you then recommend for somebody in that state? Because I'm thinking about someone who is potentially listening right now and they recognize that within themselves, right? And they're like, I have been feeling like this. I've been suspecting that I might be burnt out and it is work related, but I don't know what to do. So what are the first areas, lines of intervention that they can then look into?
So, like, you know what? So, number one is self-awareness. Okay, you know yourself. And so, if you can see that I am not quite myself, something is wrong, your body won't lie to you. All right? Believe your intuition and say, okay, let me get help, you know? And so, sometimes the help is to go to a general practitioner and say, I'm not feeling okay. And they will see how they can best help to intervene. And most of them are becoming more aware as well, because not all doctors are pro mental health. But most of them can see that, you know what, I can see you're not okay, you are crying a lot, you're having a lot of non-specific symptoms, you know, a headache that starts on the head and finishes on the toe. You know, those are non-specific symptoms sometimes. And so they can say, okay, there might be stress. And most of the time, that's a thing that they would say, it's stress. And so they will be able to try and help. And if they feel like it's beyond their expertise, then they will escalate. And so for me as a psychiatrist, if someone comes with work-related problems. Or sometimes they don't come and say, I am burnt out. They just come and say, I'm not sleeping well, I'm irritable, I'm not as productive, I had a fight with a colleague at work, and that is out of character for me. You know, my family don't enjoy me. When I come home and I go to bed at 6 o'clock, I haven't made supper, I didn't help my kids with homework, I'm just not myself. And I'm like, but that is burnout, you know, and then we need to take a time off, you know. So one of the things that I do is that for work, I usually refer patients to an occupational therapist, you know, so they can do a thorough assessment to see where are you struggling, how severe is the struggle, and what help can we, I mean, what structures can we put in place to help you? And most of them, some of the structures is that the occupational therapist can also become what we call a case manager who can liaison with your employer on your behalf, you know. And so I saw Mbali, she's really struggling at the moment with her memory. And so can we try and do this? Can we make her work more structured? Or speak to you directly to say, you know what, but I can see that, excuse me, you're not as organized as you could. And so what are the structures that we can put into place to help you with organization, how you spend your time, how you spend your leisure time, how you prioritize even work, you know, because not everything that is important is urgent. You know, and so people don't know how to organize that everything becomes urgent and everything must be dealt with now. And sometimes we give attention to things that are not as important, you know, and so the occupational therapy is able to help you with that. But I appreciate the fact that unlike me as a psychiatrist who just writes a report and send it to an employer who can read and dismiss or be like, oh, whatever, the occupational therapist has that engagement with at least HR to say, this is what we recommend. What can we do to help you implement this for this person at work? And I found that most people, most occupational therapists, when they have an HR who's willing to work with them, they're able to help the person. You know, it's more like they have a broken leg and they are on a moon boot or a plaster. And what changes can we make just to make sure that the plaster stays on and that they can heal, you know? And so can we move them to the ground floor instead of letting them climb the stairs? And so when it's physical stuff, the employer is always
they
happy
understand.
to move the furniture around to accommodate you. But when it comes to mental health, which affects everything, you know, the leg affects my leg and my mobility, you know, but it doesn't necessarily affect my concentration and all that. But we're willing to accommodate fractures more than we're willing to accommodate the CEO.
Sure.
You know, which is the brain. And so those are the things that I usually would recommend, that, you know, see an occupational therapist, but also see a doctor, because sometimes there might be some things that you need. Maybe sometimes you're not sleeping, you know, and then we can address your sleeping pattern, whether it's through medication or what we call sleep hygiene. That is something that you guys can check out. You can just Google sleep hygiene, you know. Yeah, but most of the time people just need to take a step back, even if it's just a week, you know, and just recuperate and see what changes do I need to make, because whatever I was using 5 years ago, it doesn't work anymore. All right. And so people don't want to do that. They get into a higher position and they still want to continue the same way they did. They are evolving, they're growing in their personal lives, they go into family life and all that, but they don't want to readjust. They're just driving in second gear all the time and then get frustrated why they are not moving or why there's a background noise and your car is complaining. It's because you just need to change the gear as, you know, you gain the momentum.
Sure. So this is also making me think about a separate conversation that we had sometime last year when we were running the IG Live series on Instagram around workplace wellness. And one of the questions that we received during that series was around medical treatment. So, and I want to bring this up right now because I think it's also a bit of a contentious or misunderstood area around treatment. And I would like for you to just shed light on when is it then necessary to engage medical treatment? And from your experience, when do you recommend that over an occupational therapist, or in conjunction potentially with an occupational therapist?
So if there's disruption in your day-to-day life, whether it's socially and occupationally, and if there are changes in what we call neurovegetative features, which is your sleep, meaning that are you having a deep sleep, and is it a restful sleep? Because not everybody sleeps and actually sleeps. People will tell you that I sleep, but I wake up every 5 minutes or every 30 minutes. And so when I wake up in the morning, I'm tired. So it's not restful sleep. So if there's changes in your sleep, changes in your appetite, and most of the time is appetite suppression. I just eat because I don't want to starve, but I don't enjoy food, and then I'm not bothered by not eating. Then if there's changes in your appetite, and sometimes patients will say, I'm stuffing my face with food, excuse me, because I'm always anxious. And so if I have a bowl of ice cream, I feel like I'm much better. And it's usually what we call empty calories. So they will binge on carbs because they make you feel better somewhat, because it plays around with your sugar. So if there's increase in appetite as well, sometimes there is worry. And then your energy level. And so how energetic are you? Do you feel like you are tired all the time? Most people will tell me that I just feel tired all the time. I don't feel like I'm capable of doing anything at 10 o'clock after getting at work. I just feel like I'm finished. And I'm just sitting there, a term that we call presenteeism. Yeah, right? I'm just sitting there waiting for the clock to hit and I can go home. I didn't do anything because my mind is just tired. And sometimes it's a mental fatigue where people feel like their brain is full. So these are the words that they explain. It's not the words that we have in the textbook, but this is the stuff that patients come and say, my brain is full. I feel like, my inbox is full and I need to delete some things, but I don't know what to delete or how to start. And then changes in your sex drive. Most of the time it's just no interest in sex at all. And it is part of our livelihood. And so if that becomes compromised, so if these 4 features gets compromised, then we start worrying that we need to help you. And what I want to say is that your brain is an electrical organ. It runs on chemicals as well. And so when someone is under constant pressure or someone is sleep deprived, it changes the chemicals in your brain. And those chemicals must be balanced for us to have a normal mental health. So when there is chemical imbalance, then we see it physically by changes in your mood, changes in your anxiety, changes in your sleep. And so we need to restore that chemical balance. And depending on how severe it is, most of the time we might require medication. All right, just to restore that chemical balance. And for some people, it's a long-term thing, and some people it's just a short-term thing. But like I'm saying, people are not coming. When people come and say, I have an issue with my boss, or I'm not doing well at work, when we speak to them, we realize there's more to this.
There's more to that.
All right. Your boss might be triggering some childhood trauma that you experienced. And so just dealing with your work and not deal with your previous traumas, it's more like we're putting a plaster, And so sometimes people come to us and they think they want to deal with one angle, but as we speak to them, we uncover that there's more to you than this one particular thing. And then, of course, I will always say to them, we need to prioritize. We can't deal with everything all at once. And so what is the urgent thing and what is the important thing now that we need to address? But please do not neglect other areas of your life. You need to go to therapy to deal with your insecurities that are now playing out at work, so that even when somebody comes and lovingly corrects you or critique you, with no intention to hurt you, but because you had some issues with a teacher, in grade 5, who used to tell you that you won't become anything. When somebody loving, like Mbali, comes and say, hey, Clementine, I'm worried about you, suddenly a bomb explodes, and it's not necessarily because of the work, it's because of what happened, So, it's things like that. So medication does play a role in restoring, or what I call what I say to them, we need to ground you.
Yes,
All right?
equilibrium.
Let's just ground you.
Yes.
And so let's get you to sleep, because I personally believe that sleep is the greatest healer. All right. When you sleep, your brain gets to reboot. It gets to go back to 0 degrees Celsius. So that when you wake up fresh. If you don't sleep well, you wake up with yesterday's pressures. And so your temperature is always towards a boiling point.
Yes.
And that is not healthy.
Yes.
So sleep is one of the things when I say, you know what, at least let's get you to sleep. And not all medication that are for sleep are addictive. Because the main thing is that, no, I'm going to be addicted to this. I'm going to be dependent on this. And so not all sleeping medication is addictive, And so we as psychiatrists at least try to not prescribe something that is habit forming, not even addictive, but habit forming, meaning that over time you might need more of it. So sometimes what people call, I'm going to be dependent on it, it's like in a negative way as well, because I always say to them, is somebody with diabetes dependent on insulin? Yes, they are. Is somebody with depression dependent on an antidepressant? Yes. Is somebody with HIV dependent on ARVs? But when it comes to mental health, it's just like, no. I can live with the pain. I can live with the discomfort. And so even though when we spoke about stigma, is that there's a concept of self-stigma.
That's what I was thinking about as you're talking, actually.
Because people will be like, no. They feel like they need to punish themselves. And I'm like, if your leg is broken, you just need to get the crutches and the moon boot, to secure your leg so your leg can heal.
Sure.
All right. And so the medication is not to control you. It's sort of like it's a moon boot to your leg so that your brain can heal itself. And if you heal in 3 months, there's no need for me to say, oh, no. The leg can break again. All right. If I can see that there's progression, that you are kinder to yourself, you are following through, you are changing your environment, then I'm happy for us to review whether or not you need medication. So there's nothing wrong with medication. It's actually very, very helpful to have medication. And we manage the side effects that most people might be worried about.
Yeah. So we've been talking quite a bit about what the individual can do, right? And I think that is a very important starting point. To your earlier points, you mentioned that self-awareness is key. And once that awareness is there, it's seeking the right help, the right support to help you deal with whatever mental health challenges you might be experiencing. But I think there's also a shared responsibility where employers are concerned, because the person can be healthy, but if the environment remains unhealthy, that can, cause them to potentially relapse. And I think then there's that responsibility for the employer to then say, how do we create environments that promote mental wellness and sustain mental well-being, especially for individuals who already are mentally well, and what strategies then can we put in place to support those that are potentially at risk, whether it's for depression or potentially suicide.
So I feel like, just as individuals, when we go to work, it's just important to try and say, I'm going to be the pleasant person at work. If everybody can have that responsibility to say, I want to be a pleasant person, it will help. So like I'm saying, I think I read an article, and I think it was posted by you, on managers and how middle management is causing a lot of actually revenue decrease. And I was not surprised, because I have come to dislike the word managers, because this is the people that everybody complains about. And I think the subordinates have sort of like seen the managers not even as my senior, but as my employer. Meaning that this manager has a power to destroy my career and to get me fired from this job. And so I have to please my manager. And so it is important that there is training in middle management, because a manager is somebody who was sitting on this side, and then tomorrow they're sitting on the other side. And of course, now they are sort of like representing the wishes from management, from above.
From leadership.
And so, from leadership. And so they're saying that this must be done. This is the target. And we want this target done. All right. And sometimes there are benefits. If you reach this target, we're going to give you a bonus. But the manager is not the one who does the actual work. So they put pressure on their subordinates to meet those demands for their own good. And sometimes how that is communicated can be very hostile and can be very discouraging. And so I think there was one of my clients who told me that the company took them for a leadership training. And one of the things that was so fascinating is that in leadership training, they speak about empathy. All right, so empathy is a new thing now in leadership training, that actually when you show empathy to people, they're bringing out the best in them.
That's it.
Well, in the past, it was like, you must be harsh, you must be very assertive.
Results driven.
Yes, results driven, no emotions whatsoever. And if it's emotion, it must be anger and threats and, and make people feel guilty and inadequate. But now if we can train our managers to show empathy, to be emotionally quotient, the emotional quotient at work is very low. And sometimes we see that with intellects, very high intellectual people, they are emotionally
low EQs.
Yes, their EQs are very low. And so how do we teach that? How do we teach? How do you speak to somebody? It really goes a long way. Another thing is that most big corporates have mental health policy, but they are not implementing it. Like I'm saying, they're able to accommodate somebody who's now in a wheelchair. All right. But when somebody comes from a long leave because of mental health related issues, they don't know what to do. And most of them is either they tiptoe around them or they don't trust them for bigger projects because they don't want to cause stress. They don't know how to sit down with them and say, okay, how do we incorporate you back at work? Or this is the strategy that we think will help you to gain your confidence, because a person who gets admitted, it's more like they have fell, it affects their confidence. Most of them, they have low self-esteem. They feel low, they feel down, they don't trust themselves, they don't think they're capable. And so just to validate that we know that you might be struggling. And so these are the strategies that we've put in place just to help you, whether it's we're going to allow you for a month or so to work half day, or is it more productive for you to work from home because then there's less distraction, so we're going to allow you maybe 2 days to work from home, and the other days we're going to allow you to work in the office just so that there's support. Those little things can help restore someone's confidence, someone's energy, and help them to recover so that they can be productive at work. Work usually have wellness days.
Yes.
They check cholesterol, they check high blood pressure, check HIV. There's no mental health at all. And sometimes just bringing an expert to speak about organizational psychologist to speak about, are your structures healthy in your work environment? Just bring a mental health expert to help speak about mental well-being, in a workplace. It helps destigmatize mental illness. So I feel like mental illness is always isolated. Even in general hospitals, like if you go to a general hospital, there's no psychiatry ward. Have you seen that?
No, I have not.
Yes, there's a surgical ward, there's a pediatric ward, there's a medical ward, there's everything. Psychiatry, no. All right, it's always isolated. Our wellness centers, and we prefer them like that, but they're isolated from the general hospitals because we want to provide a more therapeutic place. But sometimes those separation create the stigma. So at work, if they can incorporate mental health, whether it's screening, there are self-screening that people can do to check at what level is their stress. Another thing is the KPIs. All right. So the KPIs, apparently, I've never done one, has a portion where they speak about your stress levels. And if you admit that you are struggling and you have stress, it actually lowers your KPIs. All right. And so even though you are in higher management and you must not be stressed. If you stress, then we lower your
at risk.
you're at risk, and then it actually you might forfeit a bonus. So people are not honest at work because if you are not coping, then you are not competent. And so they don't spend time and energy and resources in making sure that people are flourishing. They actually discourage stress in a world that is so
It's
stressful.
stressful. Yes. So in summary, I think the starting point is definitely that mental health awareness in education, right? So that managers, but also employees or subordinates change their relationship with mental health. And then secondary to that, looking at practical interventions that look at, stress levels, that look at mental wellness, that look at support, and integrating that into the culture of the organization so that it destigmatizes help-seeking behaviors and basically a culture of thriving and promoting health within the workplace. So yeah, I think it's a lot to consider, and there's different elements. And what I'm getting from our conversation is that suicide is the symptom. Or a suicide attempt is a symptom. There's definitely areas or underlying issues that need to be dealt with, whether it's in the workplace or personally, that then lends to one to start ideating around suicide or potentially actively acting on those thoughts. So there's that self-awareness element again that's coming up around knowing how you're feeling, doing that temperature check, and also then seeking the help that you need if you feel like you are at risk. So that's very key. I want to I want to just wrap up our conversation with our 3 bonus questions. It's never a podcast episode on this platform without asking my guests this. And the first question is, what book, podcast, or article have you read that has changed your perspective about work?
Wow. Okay, so the book I'm reading now for personal development actually is called You Are the Mountain.
You Are the Mountain. Okay.
So sometimes people think that somebody's blocking me, but actually I'm blocking myself. So it addresses self-sabotage. And sometimes self-sabotage, like I'm saying, can express itself in overreaction and overcompensatory measures. So I believe that if we work on ourselves as individuals, we will flourish in a workplace. And we're able to set healthy boundaries. And we're able to say that, you know what, Mbali's outburst today has nothing to do with me. I'm not going to internalize this. I'm not going to hate her because I am healthy. And so I'm not going to let other people's bugs get me.
100%.
And so if I know that I'm vaccinated for my flu, I won't be afraid to go out into the world because I'm afraid somebody might sneeze, because people will sneeze, but it's more like, no, I'm protected. I need to wash my hands. I need to do certain things just to help protect me. So yeah, You Are the Mountain. The article that I read, I actually read it when I was still specializing, and it looked at the stress levels among police officers in the US. And when I was reading the article, I had a hypothesis that, because of the nature of their work, responding to crime scenes, not knowing what they're going to expect is actually their reason why they are stressed out. But to my surprise, it was work politics that they were more concerned about, and they found more anxiety provoking than the actual response to a crime scene. All right. And so the work environment plays a major role than the actual work itself, And so if we're intentional about creating a mentally well and healthy workplace, it can help people flourish. So that is the article that I read. The podcast.
Mind Vault.
I am going to be biased when it comes to the podcast, right? And I think it's an intentional podcast that it's meant to help people be more mentally aware, be more mentally sensitive, and to take action. All right, you need to heal yourself. All right, because I always say to my clients, I can't call your manager. The manager is not here. You are the one who's here. And so I can only help you. I can't change the environment. But if I can help you to be able to survive the environment, no matter how toxic it is, then I've done something. So, of course, it will be helpful when the work environment is also more intentional, but also we don't say, well, if your work environment changes, suddenly you're going to flourish. You also have to deal with yourself as an individual.
Sure.
So I think the mind vault,
those are
is
the
focusing
resources.
on the
Yes,
stuff,
I love that. I love that. And second last, what does wellness in the workplace look like for you?
It's me waking up in the morning feeling like I'm part of something big, that I'm making a difference in the world, that it's not only a place to generate income, it's a place where I interact with people, it's a place where I learn and I grow and I contribute to society. So it's a place that I look forward to going in spite of the difficulties.
Sure.
And so if everybody can wake up and be excited about going to work, then I believe that that is mental health in a workplace.
Oh, I love that. I love that. And lastly, where can we find out more about Mindvault, about your services, or any other upcoming projects you have in the pipeline?
Yeah, lots of projects in the pipeline. Hey?
Always.
Always. Yeah, I'm just like, what's wrong with me? With the Mindvault podcast, so it's on YouTube. If you just search for Mindvault, the Mindvault podcast SA. And on Instagram, also, it's mindvault _SA. For my professional page is Dr. Clementine _psychiatrist. And so, yes, we can help you. I always advise that, look for a professional within your radius. Don't go, I'm in the West End, and you don't go look for me when you're in the East End, because it's a long-term relationship. It's not a once-off thing, and it becomes not sustainable long-term. So if you're looking for help, look for somebody. Just Google somebody within your environment that is easy to access, rather than go to a person because they are on social media. All right, because we might not be able to help you as much as somebody who's closer to you can assist. So, yeah.
But you can follow her on social media because she will be sharing such useful resources and insights that might help support you on this journey. Dr. Clementine, thank you so much for this wealth of information and just the depth that you always break down mental health issues, treatment, and awareness with. It's not a surface level conversation, and it has to be ongoing because of how deep and wide it is. So thank you for your time and just insight as always.
Thank you. Thank you so much. I also enjoy talking to you. I just love so your mind is very organized, like how you summarize everything. And, you stepwise just put things. I love that. It's just so calming because sometimes my brain is just overactive and it wants to say a lot of things in a short space of time. So I appreciate your insight and your wisdom and your grace, and I always enjoy.
Thank you for this positive feedback. Thank you so much, and thank you for watching and tuning in, and also just supporting the podcast. We are growing, we are expanding, and it's just a pleasure to always have guests such as Dr. Clementine just to be on the platform to share their wisdom and expertise. Do tune in to our follow-up episodes. We will be continuing with more exciting guests and episodes on the podcast. Follow us on social media, on LinkedIn, on Instagram, as well as YouTube if you don't already subscribe to the channel. My name is Mbalim Zinyane, and I will catch you on the next episode. Bye-bye.